If you're a midwife working in delivery or ER, you will be required to process 3 different sample types on the blood gas analyzer. Adult samples, which could be an arterial ABG or lactate or hemoglobin following postpartum hemorrhage, for example, or query sepsis. Cord artery, cord vein samples, and the 3rd sample type is fetal scalp. To process a sample from an adult for lactate or hemoglobin, for example, the sample must be taken into a syringe. You can take the sample into the syringe by using your butterfly attachment. The vacutainer attachment comes off, and this can be placed on the syringe and the sample drawn into the syringe. The attachment can go back on to the vacutainer attachment if you are required to take samples for the lab at the same time. This will avoid having to puncture the patient twice. These syringes require a minimum of 1 ml of blood. If you do not have a minimum of 1 ml of blood, you run the risk of breaking the analyzer probe on the plunger in the syringe. This will result in significant downtime until the needle can be replaced. So please ensure you've at least 1 ml of blood in this syringe. To log on to the device, you touch the screen and you scan your badge. Be aware that the barcode scanner is at an angle, so you will have to hold your badge at an angle to scan successfully. The available parameters are at the top of the screen in green. If a parameter you require is red or yellow or orange or has an X through it, this means there's a problem with that parameter and you won't get a result for that particular parameter. You will need to use an alternative analyzer. If it's a parameter you don't require, you may proceed. As with all samples, ensure they're fully mixed. This will ensure the sample is heparinized to minimize clots. We do not want to get a clot stuck in the analyzer because, again, it will result in significant downtime until the clot can be flushed. Invert back and forward to ensure a homogeneous sample and accurate results. Remove the lid and get rid of the first drop of blood onto a tissue, ensuring no big air pockets. Press syringe and the inlet pops up. Hold the syringe to the inlet and push back until it stops. Allow the sample to aspirate. Wait for 2 bleeps and then remove. If you remove too soon, you'll get an aspiration error. It will default to pH and gases. If these aren't required, you can remove them and select lactate, for example, if there's been a PPH or query sepsis. You can add on hemoglobin. Please ensure whatever parameter you require is ticked and whatever parameters are not clinically indicated are unticked. You can press proceed. If you don't press proceed, it will automatically switch to this screen. Now type in the hospital number and enter. Enter the patient's last name. I am just entering test to denote a training exercise. You need to enter something for the patient's first name. We don't expect her full first name to be entered. You can enter her first initial. And again, please ensure the correct sample type is selected, so arterial or venous, whichever it is. Results will print shortly. If you are processing cord blood, again, this syringe is used. You must have 1 ml of blood in this syringe to avoid breaking the analyzer probe. However, it may be difficult to get 1 ml of blood out of a cord artery, especially in a premature baby. In which case, you can use one of these syringe types, which are found by the blood gas analyzer. In this case, 0.2 ml is sufficient to avoid breaking the analyzer probe. So remember, 1 ml in this syringe and 0.2 mils in this syringe. As before, make sure your sample is thoroughly mixed. This is particularly important for the cord blood samples because they can tend to clot. So we want to heparinize it and minimize clotting. We don't want clots stuck in the analyzer. Again, invert back and forward. Remove your lid as before and get rid of the first drop of blood onto a tissue. Be careful that you don't get any spray back, as pressure can build up in the syringe. As before, ensure the parameters you require are green. If they're red, orange, or have an X through them, you won't get a result for that parameter. Function, the inlet pops up. Hold the device to the inlet and push back until it stops. Sample will be drawn in. When you hear the second bleep, remove the sample. If you remove it too soon, you'll get an aspiration error. It will default to pH and gases. If you need to add anything else, such as a lactate, select it as described before. Click Proceed. Enter the patient's hospital number. As the baby has not yet a hospital number, cord bloods are processed on the maternal hospital number. Please enter the surname. You can put, if it's a cord blood, you can type in cord or baby for first name. And the sample type, instead of selecting arterial or venous, which will denote a maternal sample, please scroll down to cord blood venous or cord blood arterial, as this will distinguish cord bloods from a maternal ABG and avoid any confusion. You can select results, and the results will print very shortly. And finally, if you're a midwife working in delivery, you will be required to process fetal scalp samples. So the clinician will take the fetal scalp sample into a tube. It is good practice to fit these end caps onto the tube. These will be located by the blood gas analyzer, and mix the sample between your fingers just by twirling it back and forward. Again, fetal scalp samples tend to clot, and this will minimize the chances of clotting and preventing a clot getting stuck in the analyzer and improving your chances of getting a successful result. Remove both end caps before processing the sample, and you must attach a clot catcher to the end of the tube. Ensure the sample has no air pockets or air bubbles in it, or you will not get a result. As before, ensure the parameters you require, mainly pH in this case, is green. If it's not, you will run the risk of losing your sample, so you need to use the alternative analyzer. In this instance, you're going to press capillary tube. The inlet flips up and gently push back. It doesn't go as far back as it does when you're processing a syringe sample, and you need to apply gentle force because you do not want to bend the tip of the clot catcher, because if you do, the sample won't be drawn into the device and you won't get a result. Again, it'll default to pH and gases. If it hasn't, ensure these are ticked, and you can add on, if required, any other parameters. Just ensure whatever parameters you require are ticked and whatever ones aren't indicated are unticked. You can press proceed, or the analyzer will automatically default to the next screen. Again, type in the hospital number. H0 is not so important as long as the core number is correct. And again, baby won't have a hospital number yet, so it's the mother's surname or the mother's hospital number that's entered. Using the keypad function, enter the surname. I'm entering test to denote a training exercise. For the first name, you can type in BB to denote baby, or type in scalp. It will require you to enter something in that field, or you won't get a printed result. Under sample type, please scroll down and select fetal scalp. Again, your results will print shortly. Also, it's important to mention, please avoid presenting the end of the tube that has touched the baby's head to the analyzer. Please present the opposite end to the analyzer if you can distinguish. Please ensure that when your results print, that they are scanned into the patient chart and typed into the patient chart also. If your analyzer is running out of paper, you will see red or pink stripes appear on the paper roll. To replace it, click down on the white button to unlock the lid, remove the empty paper roll and insert a new roll, paper presenting from the underside with the shiny side out. Close the lid and press down on each side where the arrows are, and your paper is now replaced. There should always be spare roll by your analyzer at all times.
Please remember the following key points. Blood gas analyzers are located as follows: 2 in delivery suite, 2 in NICU, 1 in theatre in the recovery room, 1 on the gynae ward, 1 on postnatal and 1 in ER. Never share your badge access with other users. All actions are traceable back to your ID. Please always enter the correct patient MRN to the device. This is mandatory. Result interpretation is the responsibility of the caregiver. For any tests that can be repeated in the main lab, for example, hemoglobin, sodium, potassium, bilirubin, etc., action should not be taken solely on the point of care result without confirming in the lab first. For any queries, please contact me by email, lpensney@rotunda.ie. Emailing me is a more efficient way for me to get a response, as I'm often away from my desk given the nature of the job, and I will get back to you as soon as I can. Thank you.
Moodle is checked periodically for training completion. Access to the device is usually granted within 1 or 2 days of you having completed your training. However, during busy periods, or if I am on annual leave or out of office, for example, there may be a delay in having your access activated. Please be patient. Any queries in email to lpensney@rotunda.ie.